Standard Occlusion Theory for TMD. I am Sotokawa, a dentist practicing in Morioka City, Japan. This theme covers the occlusion theory essential for treating temporomandibular joint disorders, organized into the following 24 topics. This time, I will explain the first topic, occlusion theory. Standard occlusion theory for TMD. 1. Occlusion theory. Contents. 1. What is occlusion theory? 2. History of occlusion theory. 3. Occlusion theory of present. 4. Meaning of occlusion theory. A. Proper occlusion theory of prosthesis. B. Diagnosis and therapy of malocclusion. C. Examination and diagnosis and therapy of occlusal disease. D. Oral rehabilitation. E. Evidence of normal occlusion. 1. What is occlusion theory? The theory of occlusion is a theoretical framework constructed by understanding the structure and function of the human masticatory system and elucidating the mechanisms of human bite alignment. It is, in essence, the functional anatomy of human occlusion. On the other hand, malocclusion causes various disorders in the masticatory organs. Occlusion theory provides crucial information for developing treatment methods for diseases caused by such malocclusions. Dentists who understand the relationship between the occlusal surface and the masticatory organs can diagnose malocclusion and develop appropriate treatment plans. 2. History of occlusion theory. The theory of occlusion emerged in the late 19th century amid debates concerning the occlusal forces applied to artificial teeth in complete dentures. During this period, Bonwill and Spee proposed the Bonwill triangle, three-point contact, and Spee's curve. Around 1890, the dental community began advocating balanced occlusion as the ideal occlusion. In 1926, McCullum established the California Nasological Society, with members including Stallard and Stewart, marking the start of serious nasological research into mandibular movement. Subsequently, mutual protected occlusion came to be recognized as the ideal occlusion for natural teeth, while organic occlusion became recognized as the ideal prosthodontic occlusion. Furthermore, group function occlusion was proposed as the treatment goal for dentate arches. As described above, occlusal theory has developed to the present day as a fundamental discipline in dental medicine. We dentists must learn the current international standard occlusal theory cultivated by numerous dentists and researchers. 3. Occlusion theory of present. The theory of occlusion has been cultivated over the past 100 years through the clinical experience, experiments, research, and discussions of researchers worldwide. The current theory of occlusion has made remarkable progress, primarily in the United States. In American university education, Occluson's specialized textbook is adopted as a standard, and many dental students receive education in occlusion theory. Furthermore, Dawson, author of Functional Occlusion, and his colleagues have played a crucial role in the development and dissemination of occlusion theory by organizing conferences and seminars through the Dawson Academy. The current occlusion theory is summarized in Dawson's Functional Occlusion. 4. Meaning of occlusion theory. Occlusion theory is relevant to all dental treatments and its application is indispensable in dental care. In particular, occlusion theory elucidates the relationship between malocclusion and temporomandibular joint disorders, making it an essential discipline for the diagnosis and treatment of occlusal disorders. Furthermore, occlusion theory serves as a guiding principle in the following areas of dental practice. A. Proper occlusion theory of prosthesis. B. Diagnosis and therapy of malocclusion. C. Examination and diagnosis and therapy of occlusal disease. D. Oral rehabilitation. E. Evidence of normal occlusion. I will explain each one. A. Proper occlusion theory of prosthesis. During prosthesis placement, occlusal adjustments are performed based on occlusal theory. By performing occlusal adjustments based on occlusal theory, the prosthesis harmonizes with the patient's masticatory system, preventing occlusal disorders and periodontal diseases that arise from improper occlusion. B. Diagnosis and therapy of malocclusion. In the following cases, it is difficult to detect malocclusion. When the occlusion of prosthetic devices fitted at other dental clinics is inappropriate. When orthodontic treatment has been interrupted or has failed. When the impairment resulted from prolonged neglect of an improper occlusion. Even when these malocclusions are difficult to detect, conducting examinations and analyses based on occlusal theory allows us to identify them. As a result, appropriate occlusal adjustments or occlusal reconstruction become possible, enabling the correction of these malocclusions. C. Examination and diagnosis and therapy of occlusal disease. Occlusal disease is a group of disorders caused by functional malocclusion. Occlusal theory is indispensable for the analysis, diagnosis, and treatment of occlusal disease. In other words, by mastering occlusal theory, dentists can examine patients with occlusal disease, identify its causes, and establish treatment plans. D. Oral rehabilitation. When faced with the necessity of reconstructing a new full-mouth occlusion for patients with teeth, so-called oral rehabilitation, treatment outcomes vary significantly depending on whether the dentist possesses occlusal theory. One approach to treatment goals involves establishing an ideal occlusion. However, the treatment goal increasingly accepted today is a malocclusion-free bite tailored to each individual patient. Therefore, advanced occlusal theory is indispensable in oral rehabilitation. E. Evidence of normal occlusion. Patients sometimes visit our clinic after being told by doctors in other departments, the cause of your symptoms might be related to your bite, so you should see a dentist. In such cases, we check for malocclusion and work to improve the symptoms. However, if the patient does not have malocclusion and the cause is believed to lie in a condition from another medical specialty, the dentist will issue a response letter stating no abnormality in the bite. This response letter must include an analysis of the bite and its results, proving the absence of bite abnormalities and providing evidence understandable to the referring physician. These examinations, diagnostic reports, and response letters can be issued by mastering occlusion theory. Summary. By learning occlusion theory, dentists become capable of analyzing a patient's occlusal condition. As a result, dentists who master occlusion theory can identify a patient's malocclusion and establish a treatment plan to resolve that malocclusion. Occlusion theory is applicable to all aspects of dental care, and its application contributes to improving the quality of dental care. Furthermore, occlusion theory plays a crucial role in helping patients suffering from diseases caused by malocclusion. Standard occlusion theory for TMD. 1. Occlusion theory is now complete. If you enjoyed this topic, please click the like button. If you have any questions or concerns, please write them in the public comment section below. The next topic is the temporomandibular disorders.